Hi, my name is Olivia Shasho, and I'm going to be doing the video validation for maintaining a peg tube. So I've done my 7 steps. I've checked the physician's orders, washed my hands, identified the patients, introduced myself, provided privacy, and explained this procedure, and I have my equipment all ready. So coming in, I'm going to raise the bed up to working height, and I'm also going to raise the head of the bed up to 45-degree angle, and that's because digestion happens best at that angle. Next, I'm going to stop the feeding tube once I get the head of the bed up. Okay. There we go, 45. So yeah, I'm going to turn off the feeding tube. So now it's off. Ask the patient, how are you feeling? Do you have any nausea or discomfort? They say no. Next, we're going to look at the stomach before we listen. And we're looking for distension or any sort of weird signs like that. After we've looked, we're going to listen, and we're listening for some sort of gurgling just to know that the intestines are functioning properly. And you're going to start in the lower right hand quadrant and listen for about a minute, going in a clockwise fashion through the quadrants. Okay? Okay, so now that we've listened, I'm going to wash my hands and put on clean gloves. So wash my hands, and I have my gloves right here ready to go. This is not a sterile procedure, so it's just clean. I have my bottle and syringe. The bottle has tap water in it. It doesn't need sterile saline because it's not a sterile procedure. I'm going to put down my protective pad. The shiny side goes down to prevent any leaks. Okay, so now I'm going to kink the G-tube and disconnect the feeding tube. I'm going to place it right on the protective pad so it doesn't leak anywhere or get dirty. I'll then be taking the syringe, connecting it right into the G-tube, and unkinking. Now you're just going to give it a little push, and it will push back an amount. Looks like it pushed back 40 milliliters. This means that it's safe to push back into the patient and or reinstill into the patient and continue with the feed. I'm going to note the color, how much came back, and the consistency, odor, viscosity, whatnot. So the only thing is, if it pushed back more than 100 milliliters, what we would do is we would take this, throw it away, and stop the feed and let the physician know. This means that maybe the food is not being absorbed, and it's something the physician needs to attend to. But we've only got 40 milliliters, so we're going to just push that back, reinstill it into the patient. Now we're going to irrigate it. So I'm going to kink the tube, remove the syringe, draw up 30 cc's, and then we're going to slowly instill the 30 cc's into the tube. I'm going to kink that up again so no spills happen. Then we can take the feeding tube, reinsert it, and then turn the feeding tube back on. Then what we're going to do, rinse these out and place it back in the box. Then label it with the patient's name, date, and time. And and then you're definitely going to want to make sure you document all the input and output in your nurse's notes. So document all the coloration, how much pulled out and everything, and then wash your hands at the end, lower the bed, and make sure that the patient has the call bell as well, making sure the bed is all the way at the lowest level. And that is it. Thank you.